Hi, this is Ron Heinlein with DTFFootwear.com. And what I want to talk about on this live video is bunions. Any of you out there have bunions? Okay, what causes bunions? Well, bunions are normally on the side of the foot by the first flange, your first toe, or there's a talar bunion. It's right next to or by the fifth toe, or from that aspect. And what it is, it's a calcium buildup. What you've done is you've squeezed your foot in your shoes so bad that your foot is using it to a protective device. Okay, and calcium, it builds up more and more, and there's some other components, but this is a simple layman's term, a way of putting it. And as you put more pressure, it keeps rebelling, or the bunion grows. It can create an overlapping toe because your first flange or your first toe has nowhere to move, so it laps over onto your second toe, or vice versa. Your second toe overlaps over your first toe. And what basically happens is that it can keep growing. It can keep growing. It can keep growing if it isn't corrected to a point. And I've seen some huge bunions, and I've seen minor bunions. But the question I have, people ask me, do they grow? Yes, they can grow if the irritation is still there. What is the cure for it? It used to be surgery, that they would cut the bone and take the calcium and the buildup and get that, sew you back up. Will your toes ever get back in the normal place? If they put a spacer, depends how bad it is and everything else. From that point, just put a spacer in between your toes, and basically that will put the ligaments or muscles in more of a neutral position. Again, now it's laser surgery, and again, I'm not a medical doctor, and the point that I can answer these questions completely correct for you, but there's laser surgery that cuts that, and it's less cutting and everything else from that point. Now, again, older people, do I recommend it? This is just my personal no. Because the older you get, the tougher it is to heal. The more the pain is multiplied, in many cases 2 or 3 or 4 times more. And we have to do is basically live with that. And what we want to do is not prevent it and not create more buildup. And that is shoes that are properly have the proper width for you, for your metatarsal area, and doesn't squeeze it and irritate it. Also, we want to have something that's forgiving the material. There's different types of materials, stretch materials, one name that's used for it that overlaps on the bunion and it gives, so it doesn't irritate, dig in, and add pressure to it. There's shoes that we make that have split gills that actually have stretch material in there that gives and offloads that. Offload is taking pressure off of it. I use that word quite often. So basically, I'm going to back up a little bit because the lighting is from the windows coming through. And so these are things that, yes, if it's you can have surgery done, and most of it is very successful. Is there pain to it? I don't know about the laser as much as I know the surgical was very painful in my days of selling shoes out on the floor and everything else for that, because I heard a great deal of stories. A lot of people said they'd never do it, but laser, I think it's more. But again, the older you get, the tougher it is to go through things of that nature. And we can offload it. The insert putting underneath that will help soften that area. Again, we will not get rid of the bunion. We will not get rid of a bunion, please. We can get rid of corns. We can get rid of calluses. Bunions or overlapping toes, no, we cannot cure, get rid of it, but we can offload it and make it comfortable and not enhance it any farther. Have it not to be irritated. Redness in the hammer toes and so on is stuff that you see that has irritation. So this is a helpful hint to let you know what shoes can be done. The good therapeutic shoes will offload bunions, but it'll take a certain material. Leather is not as forgiving. Your bunion, your toes are not as strong as what they used to be in most cases in the 30s, 40s, 50s, whatever the age. And a lycra or a stretch material definitely has more flexibility. So that's something we can help you with and go into it and understand it, because we see what we call gnarly feet. I had a gentleman yesterday or the day before text me his feet, and he had swelling in his feet and his instep. He had it in the top and a little bit in the ankles. And I wrote back to him, texted him back and said, your feet look great. And he says, compared to what we see every day. And he said, LOL. And no, his feet were fine. But we've seen some very, I call gnarly feet, and we've been able to fit them and work out very well. So if you have a bunion problem, you need some, get it resolved or offload it. Again, I can't tell you what surgery, I can't tell you, anything of that nature. That's not my capabilities. But I can get you the footwear that'll work and everything. So again, if you got healthy feet, God bless you. And I've said this at every ending of our video, I want you to make sure that you tell your friends and let people know who we are. The word of mouth has been our biggest form of advertisement. And thank you for listening to this video.